Hey, it's Tim from ChiroUp, and today we're going to talk about assessing and treating the #1 cause of dizziness, and that is BPPV. This involves the semicircular canals. There's 3 of them on each side, and those canals are hollow tubes that are filled with tiny nerves. They're connected to a sac called the utricle. The utricle has fluid, and when we move our head, that fluid flows through those canals, stimulates the nerve, and tells you where that fluid's sitting in relation to gravity. So sometimes that utricle collects some junk, like any other tank in our body, and that junk can get caught in one of the tubes. When that happens, we have problems because now the brain perceives that as being in a different position than the other tubes, and you get dizzy. So it's important for us to identify which tube and which side is involved. So knowing where the tubes are is #1. First, we have the horizontal canal. That canal is oriented like this, and in order to sling fluid, we're going to move our head from side to side like saying no. That's how fluid moves through the horizontal canal. The anterior canal is oriented more in this fashion, and that's going to sling fluid by saying yes. And finally, the posterior canal, or lateral, which is oriented more in this position, is going to be stimulated by tipping your head from side to side. So those 3 canals, knowing where they are, is going to tell us where the problem is. Now, horizontal canal BPPV is very rare, less than 3% of all cases. Most cases involve the posterior canal, so the side-to-side movement of the head is where that happens, more than 90%. And the way that we test for posterior canal BPPV is a simple test called the Dix-Hallpike maneuver. The way that works is we have the patient long sitting on a table, and then we're going to rotate the head and go into extension so it takes it over the edge of the table and say, is the posterior canal involved? So it looks like this. Patient's lying down, we come back and toward the right side, and I'm testing the down ear. So right now I'm testing her right posterior canal. If she says, yes, that makes me dizzy, we're going to let that settle for a second, and then we're going to sit her back up and let everything settle down. I'll test it on the opposite side, and we're simply comparing from side to side which side produced more symptoms, and that would be dizziness or nystagma, or sometimes even some nausea that goes along with it. Remember, the ear that's pointed down is the side that's involved, and that's the posterior canal. So once we know that it's the posterior canal and we've identified the side, let's say it's the right side in this case, we have our key treatment, and that's the Epley maneuver. The Epley maneuver is really simple. In fact, the first part of it is identical to the Dix-Hallpike test. So we're going to do the same thing. We're going to identify that affected side. It's the right side in this case. We're going to come back into extension and rotation relatively abruptly. And from here, everything slows down. So from now on, we're going to move very slowly. Think of this as a snow globe. In between positions, we want the snow to settle. So once the patient says, I have no lightheadedness or dizziness in this position now, we're going to give it another 10 or 15 seconds, and then I'm going to slowly rotate her head to the side over the course of about 30 seconds. I'll move quicker here, but we take about 30 seconds. We'll again let that lightheadedness and dizziness stop, and then we'll instruct the patient to hold your head locked over your shoulder. Keep looking over your left shoulder the whole time. And while you're in that position, now roll to your side to face me. We're going to make sure that the patient is stable because remember, they may have some dizziness, so they could come off of our table. They stay rotated toward that side. Again, we'll give it another 15 seconds or so after she says no more dizziness. And then we're going to have that patient stay locked in that position and sit straight up from there. And again, I'm looking at her eyes to say, is there any nystagmus? I'm asking her, do you have any nausea or any lightheadedness? And once that's gone, she can come back to neutral. So the purpose of that process is to reset that crud in the canals, to hopefully flush them out, to move the debris, to get rid of the blockage. Now sometimes we have to do this a few times. We may need multiple rounds. And we can test in between with the Dix-Hallpike maneuver. We'll wait about 15 minutes in between each treatment, and we can repeat that 2 or 3 times a day. If that didn't work, then we'll wait for the next treatment on the next day. The good news is it works. 80 to 95% success rate by doing this maneuver, most of it on the first try. If you'd like to learn more about the test or the treatment, you can go into ChiroUp's Clinical Skills Library. For the test, it'll be under Clinical Assessments, Dix-Hallpike maneuver. For the treatment, it would be underneath the treatment techniques, and that would be the Epley maneuver. And if you want to learn more about the other treatments for the other canals, how to assess them and how to manage them, then you can check out the whole condition protocol for BPPV, and it'll give you all the details. This is a protocol that was derived from the research, vetted by our board, and a practicing ENT. And that's in the ChiroUp Clinical Skills Library. Delivering this is crucial because it resolves the problem so well that oftentimes goes overlooked. The other thing that we want to do is to make sure that the patient has the home care advice that they need as far as don't sleep on the affected side, how to do the foster home somersault at home, or how to do a Brandt-Daroff maneuver at home in order to keep that flushed out. So that home advice, as a CareUp subscriber, you know happens with 4 clicks. That's what makes the difference. And there's a huge difference between treating someone and applying best practices, and we're grateful that you allow CareUp to help you with the latter. Thanks for watching.